Hi, and welcome everybody. My name is Melanie Dizon. I'm the Director of Education at the Davis Phinney Foundation, and I'm really happy to have you here today for our webinar on social connections and Parkinson's with Dr. Al Condeluci. Hi, Al. How are you? Thank you so much for being here today.
Mel, it's so good to be with you and all of our friends, the Davis Phinney Foundation, and all the folks that are plugging in really from around the country.
Great, thanks. Now let's get started with a little bit of a short introduction of the great Al Condeluci. I'm so excited to have you here. Al has been a leader in community building, human services, and inclusive advocacy work for the past 50 years. He earned a PhD in MSW from the University of Pittsburgh, and he holds faculty status at the University of Pittsburgh in the School of Social Work and the School of Health and Rehabilitation Sciences. Al is the author of 7 books, and in 2018, he received the key to the city of Pittsburgh. I've never met anybody who did receive the key to the city, the highest civilian honor given to a community member. He serves as a consultant, advisor, and human service coach, is on several nonprofit boards and government commissions on the state, local, and national levels. He helped found and convenes the Interdependence Network, an international coalition of professionals, family members, and consumers interested in community engagement and macro change. Al, I'm really happy to have you here today about social connections and Parkinson's. I have to say it's pretty serendipitous. We had no idea when we scheduled this many months ago that we were going to be in this middle of a global health crisis and confined to our homes. So the conversation today is probably more relevant than it's been in a long time. So to get started, what is social capital and why is it important?
Yeah, well, thanks, Mel, again for this opportunity, and you know, we would have been planning and getting ready for a victory summit in Omaha that we obviously are not going to be able to do in a face-to-face format. So having this opportunity for a webinar and having the many folks really from around the country that are participating is really wonderful. It's another way we can stay connected, because social capital really refers to the value that people reap from their connected relationships. And the term social capital, not term, but I guess the phrase social capital, was actually coined in 1916. It's the first time it actually appeared in the literature. And it was coined by a school teacher in West Virginia. His name was Hannafin. And Mr. Hannafin was not just a teacher, but really a scholar and an observer of community. And one of the things that he discovered all way back in that early era was that the kids in his school, the kids that he taught in the small little town in West Virginia that they came from, kids that built relationships did better in not just in school, but actually did better in life. These were the kids that in the community ended up, becoming active in their community and good civic citizens. And they weren't necessarily the smartest academically, but they were really socially savvy. And so he wanted to in some ways bring value to this phenomena. So he called it social capital, that using the term capital meaning value, that the kids that were socially astute were more successful in their community. And so he ascribed this term social capital. Now, after it appeared in the literature in 1916 for the first time, sociologists and academic scholars noticed it and really began to probe a bit more and start to explore it a bit more. And in the ensuing years, academically, the term really came a vogue with scholars, and the use of social capital as compared to physical capital was really clear. The sociologists really wanted to show that our social networks and our social relationships bring value to our life. Around 1990, the concept really was popularized in the literature beyond the academic areas, and it started to appear in some just mainstream literature. And in the year 2000, a Harvard sociologist by the name of Robert Putnam actually really popularized the term and put it into the public square by raising attention with elected leaders to the potency of social capital. And once public leaders started to recognize that when people built relationships, not only did they value, but their communities valued, that people solved problems more readily, people became more pro-social who had relationships, they were more compassionate, they were kinder, more honest, based on relationships. And so Putnam, observing this and really looking at it academically, decided to popularize it and then to embed the concept of social capital into the civic square. And so, he at the time really became like a darling of not just politicians in the United States, but really politicians around the world. And so the concept and the construct of social capital really began to take off in the public square. And politicians began to recognize that the more they could promote the building of relationships with the citizenry, with their constituencies, the better society could be. So that's kind of a long-winded answer that kind of moved it from this educational observational done by Halifin, and then its intellectual development by sociologists that followed, and then the popularization of the concept in the 1990s and in the 2000s with Putnam. Bill Clinton really began to try to take concepts of social capital and embed them into his administration, and I think subsequent presidents have looked at that, and I think the other thing that when Bill Clinton became introduced to social capital that really got him engaged was George Herbert Walker Bush, when he proposed his he had his construct of stars. I'm trying to remember now the actual term that he gave to citizens who basically really did good things for their communities. And so we see this construct kind of moving full force. Now, let me just quickly add why it's important is both an internal and an external phenomena. Internally, relationships make people better. They make them stronger, they make them healthier, they make people more self-confident, more comfortable, more self-assured. We get, when we build relationships, we get this sort of feedback of our viability as a human being from other people that we have in our networks around us. So it has an internal impact that's phenomenal, but it also has this external impact in that it makes other people better as well. It makes us collectively better. So that's, I think it's important both internally and externally for us as a society.
Great. And so knowing how important social capital is, and also knowing that we have a large prevalence of loneliness and
Mhm.
isolation in the world today. How does that play in? And what's the difference actually between social isolation and loneliness?
Yeah.
Um,
Well, yeah, that's really a powerful notion, and actually, it's where most of my practice has really been going, Mel, over the last 2, 3 years. I've been writing about social capital and actually studying it since my introduction to the concept back in the mid '80s, and one of the things that really became clear to me as a disability advocate. And by the way, let me quickly add for the listeners at the webinar that I've been a disability advocate my entire life. Growing up in a big Italian family, I grew up with a cousin that had Down syndrome, and saw how she was treated by people in community, how she was denied access and opportunity, how she was made fun of by people, how she was left behind, not by our family, but in a broader community way. And then as I got older, I really experienced from a very personal sense the phenomena of Parkinson's when my dad was diagnosed with Parkinson's, and as a family supporting my dad. And one of the things I noticed personally, both with my cousin as well as with my dad, was that when disability occurs, whether it comes later in life, like it did with my dad, or earlier in life, like it did with my cousin who was born with Down syndrome, that people who had disabilities had marginally less social capital. And in my practice, running an agency that served people with disabilities, I noticed this prominently, that people with disabilities are oftentimes uh, disconnected and have less social capital. On the congenital side, with my cousin Carrie, she never built social capital to begin with because she never really had access or opportunity. And with my dad, who was very, very active in community, he was the editor of the local newspaper, he was a musician, well known in our community. When his Parkinson's was diagnosed, and dad started to show some of the symptoms, the tremoring and some of the facial freezing and whatnot, he began to pull himself out of the mix, as well as other people began to abandon him. When I say abandon, I think I don't mean it from a malicious point of view. I think the abandonment that people began to do with my dad was more around their uncomfortableness and their hesitation and their nervousness about how to talk with him or how to engage with him. But regardless, his social capital started to diminish. And and in my work with folks who experience Parkinson's, I see this, I hear this from my colleagues and friends who work in the field, and so this notion of isolation and loneliness at the root of your question is really, really predominant in disability arenas. But that's not the only place it's predominant. It also is predominant in aging with elders, just generic elders. It's predominant with mental health conditions. It's predominant with folks in minority communities, single parents. There's other groups of people who are at risk of social isolation and loneliness. So let me sort of describe them just quickly. Um, Social isolation really speaks to the absence of a core group that you rely on for social nurturance and for human connectedness. So when people are socially isolated, they're really they're limited socially. Loneliness can unfold in the presence or the absence of social isolation. Give an example here. I don't really feel that I'm a socially isolated person. I have a large cadre of family, friends that are really important to me, that I take really seriously, and I really look to nurture and work on. So I don't feel socially isolated at all. However, when I travel, I can feel lonely if I'm traveling somewhere. Like I come to Omaha to do a victory summit, and I travel by myself, and I get there, and even though I see my friends there, I still miss my family, and I miss my routines, and so loneliness can happen in the presence or absence of isolation. But isolation is really the toxic phenomena. And actually, Mel, it's so toxic that social isolation has been identified by our CDC and the World Health Organization and other public health entities as a determinant, a negative determinant for healthfulness. That it's a clinical variable. It's actually a social variable that ripples into a clinical phenomena that really puts people at risk, a health risk. And Putnam articulates in his work that actually social isolation can lead to death, to premature death, and that there's example after example of how when you become socially isolated, you can be at serious risk of literally dying. Life expectancy data is very, very clear that if you look at the determinants for a longer life, one of the key determinants that overrides things like obesity and not getting exercise and stress and diet, smoking, all these things that we're taught are really important for a longer life, actually take a back seat. They're important, but they take a back seat to relationships. Social capital is absolutely critical.
So where does desire fit into that? So I think like everything, there's going to be a spectrum, and there's going to be the person who feels socially connected because they just have this giant group, right? And
Right.
there are others that really like to be alone and could spend a week alone and have no problem. Is there any relationship there between the healthfulness of being socially connected and the desire to be my understanding is that the expectation, the desire is where the big gap and the pain is.
Mm-hmm.
But if it's not really your thing, you're not gonna have the negative side effects.
That's really such a great question, Mel. And you can take the question and almost interpret it from a phenomena of introversion and extroversion. There are some people who are naturally shy. They just are introverted. They don't do well in social settings, right? And then there are extroverts, backslappers and people that are the hit of the party, um, and and most people fall somewhere in the middle there. But if you take a bell curve and you sort of think about that, there's some skewed extrovert, some skewed introvert, and then most of us that that at times can be lively, and at other times we want our our privacy and our quiet time. But with social isolation, there have been now some numbers that have been looked at that really are telling whether you're an introvert or an extrovert or somewhere in the middle. And that is conventional studies that have really looked at how many people does it take in your life to literally somehow, some way guard against being socially isolated. And the data is beginning to show that the cutoff point is five important friends. Could be partner, could be a spouse, family members, close friends, but 5 is a tipping point number. And that if a person has less than 5 really, intimate connections, and when I mean intimate, I don't mean that from a sexual point. I mean it from just a trust and a really, a deep connection with the person. And so 5 seems to be this tipping point. Now, if somebody falls under 5 really close friends for whatever reason, either because they're shy, they move somewhere, they're feeling inept, they're feeling like that people don't understand them, or whatever might be the cause, that could put the person at risk of some of the ill effects of social isolation. Mm-hmm. Now, that doesn't mean, well, you run out and make 5 friends and everything's going to be fine. But it does give at least a little bit of a sense of the differential between isolation and non-isolation. And so now, when you talk numbers too, interestingly enough, now just to quickly add, some anthropologists and social psychologists that look at social capital feel that the typical person has about 150 relationships in their life with social obligation. Now that's the key word, that you have some obligation socially to that person. But 150, that's a pretty robust number. And when you think about it, I know that often if I'll say that at a presentation or I'll write about that, and people react to me, say, Al, what do you, 150? I can't even think of 5 or 6. But if you really sat down and did an inventory of your connections to people, and the best way to think about that is your connections vis-a-vis the social platforms that you play in or that you are involved in. And what I mean by social platforms is like your family is one platform. If you work, that's another platform, your coworkers. Church going, that's another platform. Neighborhood, that's a third, a fourth, fifth platform. Clubs, groups, or associations that you belong to. Even things like Facebook.
Yeah, someone said LinkedIn.
Exactly, the virtual social capital, frameworks. But 150 is really what some of the anthropologists really think gives us sort of a kind of a number to shoot at as it relates to social obligation. And they even tie in that they really feel that people that our limbic system, our brain and our brain stem and our primitive system can really only manage about 150 friends. That when you look back at tribes or villages, the average number was about 150 in a tribe, and that you just weren't able to really process that more than that. Now in today's day and age, obviously that number is changed, and we really push our limbic system. But those are the numbers. And when you talk about desire, that those really important people, 5. Now the average, by the way, of those really important people is about 18, right? 18 is about the average number of these really close relationships that are intimate, trusting relationships. But 5 is like the tipping point.
Mm-hmm. And there was, and I wish I had brought it, a recent study, there was somebody talking about that there was a pretty big percentage of people that didn't even have that.
Yes.
That's tough. When you said 150, my whole body just got heavy, and I was like, oh my God, that sounds exhausting.
Yeah.
But so what is, we talked a little bit about it, but what's the biology of social isolation? And then once we get through that, I want to talk about some of the, what's going on now, and some of the things that you're doing with people in your community and things we're doing.
Yeah.
But let's talk a little bit about the biology of social isolation.
Just real quickly. This is really fascinating, Mel, that again, in a little bit of a deeper dive in looking at social isolation and loneliness, there has really now been some very, very strong evidence that when someone is rendered isolated, that the biological flow changes for that person. Let me give an example. Back in our primitive days, when we were hunters and gatherers, and if you were with the tribe, you were safe, and your system, would function, normally. But if you were separated from the tribe for whatever reason, got lost, or somehow just got disattached, what begins to happen biologically is respiration begins to increase, circulatory stress begins to kick in, the nervous system acutes and gets very, you're alert because of your precarious situation. If you were rendered to be isolated from your tribe, you're at risk of dying, right? So all these systems begin to kick in, and they help you. They're like defense mechanisms to help the person get back to the tribe, get back to their social capital. Now, so that's a good thing, that the biology kicks in. But over an extended period of time, it's a bad thing, because if your circulatory system, if your heart's racing and your blood pressure is going up because you're worried about your precarious situation, you can't wait to get back to the tribe. That's over a long term. That's really going to have some negative effects. And that's why medical researchers have really begun to look at social capital and its tie to health. And where right now today, Mel, as we see day in and day out, Americans and people over the world dying alone in nursing homes because of the COVID-19 situation and the social distancing, and the only solace is an iPad with maybe a loved one that you're looking at, but no one to touch you, to hold you, to embrace you. That biology, that stress can even be more emphatic. And it's not surprising to me that we're seeing this just horrendous number of deaths. But the thing that just rips your heart out is that these people are dying alone, right? They're dying in the most isolated situation with these machines beeping, and so the biology of social isolation is important to understand, because your stress levels go up, and if your stress levels stay up, they affect then your immunity system, your strength, your health-related strength. So it's important to know that we've got to get people to their tribes, right? We got to get people back to those kinds of connections. And that's really what I worry about with this pandemic now, stay-at-home orders that we're all under, is that, some of us are fortunate enough to be with our husbands or wives or partners and our family. So even though we have to stay at home, we have other people we can talk with and that we can engage. But for singles, folks that are single or by themselves, and they're stuck in an apartment or a home by themselves, this is really, really toxic stuff.
Yeah.
And so I think in terms of finding ways and means to get connected, to stay connected. In fact, just today, I'm preparing for a webinar I'm going to do later this month that's designed for agencies that serve people with intellectual disabilities in group homes and in supported apartments. And the talk that I'm going to do with them is really about how can staff help keep people engaged in an era when we have to be distant. And so I'm looking for a whole variety of methods and ways. And I found a website just today called House Party. It's an app, and you could download the app. And if you have your close friends download the app as well, you can engage with them more than just like with Skype or with FaceTime or with Portal, where you can see the person and you're having a conversation with them. That's nice. But with this house party, you actually can engage in some games and some activities together that adds elements to the connectedness than just seeing. Like I'm sitting here and I'm looking at you now on this webinar, and I can see you, and that's great. That's wonderful. That makes this interview so much more personal, for me. But just seeing a person is not enough. We've got to engage. We've got to participate with them. And now doing that when we have to stay distant and we can't go to gatherings and we have to wear masks, and that just continues to challenge us in finding ways that we can engage, that we can actually do things together.
Right. Well, one of the things that's such a big concern for our people with Parkinson's is that many of them experienced anxiety before this happened. They just have maybe a lower level of anxiety or something they're constantly sort of working with, and then when this happens, that feeling of, I'm not with my tribe. I can't go to my exercise class that I go to every single week, and I see Tom, Jerry, Sharon, and Sally, right? Like I can't do those things. And I can't get toilet paper, or I can't go to the store when I need it. I mean, their anxiety just gets worse and worse and worse. And so it's this like physical response to that feeling, but then also they're physically not doing what they used to do to manage the anxiety. So it's just like this double whammy. Some of the things that that we've tried to do is, obviously we do a lot online. We offer a sketching class once a week where people can come and talk to each other and sketch. And we've said, okay, maybe if you have a workout class, you can ask your instructor to bring it online. And so all of you guys can do it together. Can you have a meetup with your exercise class that you do every day? Polly was telling me yesterday that she and Davis got on the phone. Got on the phone, or they got on Zoom, and they just rode their bikes together. And so the hour goes by really fast. None of those things are as great as being in person, but a 30-second phone call can connect you to somebody and say, hey, I'm just thinking about you, and how are you doing? And is there anything I can do for you? And I think that it's, there's not going to be this one big answer right now, unfortunately. But there are those little things that you can do every day. And one of the things that we suggest is do at least one thing a day, and just do one thing to connect with people. Pick up the phone, go outside. And, a lot of people that are able to are going outside and having 2 feet, 6 feet away party, right? Where they're just far away from each other and talking, and, or go for a walk or whatever you can do. Somebody was saying that, they have been in isolation for a really long time. This person is lucky. She's in an active retirement community. So she's still able to, my guess is that able to kind of connect with people in a certain way. But I would also love for people in the chat to say, what are some of the most helpful things that you've done over the course of the last month or two that have helped you stay connected with people? Because I think people want to hear it. They want to get all the ideas they can get, right? Yeah.
Your points, again, so well taken, Mel. And the notion of engagement is at the core here. But there's some low-hanging fruit. I mean, the example that you gave, just picking up the phone and calling somebody, that requires a mindfulness. I think it's important that we need to remind ourselves that staying connected is critical. And it's critical for me, and it's critical for the person I'm reaching out to connect with. So therein really lie I think the baseline. But the anxiety issue that you raised is really, it's real, and it's powerful. And there may even be some throws that creep in because of a disability. I know with my dad, there was some heightened anxiety to do things. But one of the things that mitigates anxiety, or that can at least lessen it to a certain degree, is if the point of contact is something that is relevant to you. Like, let me give an example with my dad. He was, a writer, an editor of the paper, but he was also a musician, and he tied together his musician skills with writing. And so he became a reporter for a downbeat magazine where he would cover concerts, jazz gatherings in Pittsburgh, our hometown. And he would write about them. He'd write an article and he'd send it off to Downbeat, and sometimes they ran them, sometimes they didn't. But so jazz music was always, for him, something he really, really loved. And so when his Parkinson's started to unfold, and Dad began to really, his anxiety started to go up, his self-confidence, his sense of other people basically, looking at him or backing away from him, all these social cues that signal you're not welcomed here, or you're different from me, you're weird. Those would kick in, and that even heightened my dad's anxiety, causing him to want to just cocoon, just to stay, in the yard, or just stay in the house. And so one of the things that we used as a bridge of engagement for Dad was his interest in music and his interest in jazz. And what we did to lessen the anxiety was that, we got Dad involved with the Pittsburgh Jazz Society, a group here in our town of jazz aficionados. My dad's experience with jazz and his interviewing of Dizzy Gillespie and Ella Fitzgerald and Earl Garner and all these great jazz people, my dad actually got to meet. When people found that out about my dad, that it made his relevance go up. And even though he didn't feel relevant physically, what we wanted to do was raise his relevance topically, and so he, his experience as a musician, when he got involved with the Jazz Society, boy, that was, that to the other folks in the room, they say, "What, you mean you interviewed Stanley Tarantine? You knew it," and so anxiety goes down when relevance goes up. And so if we think about, if folks listening to the webinar can think a little bit about what is their bridge of relevance. And then now, obviously, in the throes of this pandemic, we got to figure out, well, how can we do that virtually? Or how might we do that in a way where social distancing can be, honored? But nonetheless, I think finding that bridge of relevance is really the first step in building social capital and in beginning to bring people into your life and finding new tribe members. The one thing I want to really stress with the audience, with the folks that are plugged in today, is that we have all different tribes. When I say you want to get back to your tribe, I want people to understand that your tribe is not just people with Parkinson's, right? That is one of your tribes, just like Italians, is one of my tribes. But you also have tribe members in the other things that you like to do or that you have some competence in. If it's cooking, it might be wine, it might be, music, it might be bike riding, whatever your, relevance, that's your tribe. That's another one of your tribes. So getting back to the tribe is really not, I don't want that to be synonymous as, well, I got to be with my Parkinson's tribe. Being with the Parkinson's tribe is fine, but there's all kinds of other tribes. And when you venture into these other tribes, two really good things happen. One is you begin to feel like you're multidimensional. You're not just this Parkinson's person. But the other thing is that the other people in the tribe who do not have a disability and maybe have no knowledge of Parkinson's, they learn a little bit here. They broaden their awareness, right? So it has two positive outcomes. Right. So I think finding your tribe, thinking about what is it that I really am good at, that I like to do, that I care about, that I'm interested in, what is my passion, what is my avocation, and then finding your way across that bridge to that tribe. Now, obviously today we have to think about that from a virtual perspective, but that's not going to be forever. I mean, right. We're gonna get by this hopefully soon, but this will pass. We may, some of the norms of society will change, no question, but finding your tribe and then knowing that you have an interest just like everybody else in that particular topic makes your relevance go up. Hopefully should make your anxiety go down.
Yeah. One of the things that is that's very evident in our moments of victory stories that people share is the common theme over and over again is they took something they may have been a little interested in before, and now that they have Parkinson's, they had a renewed interest in it. And now they're sharing it with everybody else. And, somebody was a personal trainer and now they're a rock steady boxing coach, and they're working with all those people, but they're still working with their other clients. And it's, the ones that seem to be living well with it the best are those who have found that piece. Before I ask another question, I wanted to go through and share some of the ideas that people have shared about what they've been doing. Sure. So some people said FaceTime with family. Yes. Somebody said, please don't suggest 2 feet. Yeah, that was a mistake on my part. I said 2 feet. I really meant 6 feet, if not more. We've been Zooming with family and old friends, as well as our Parkinson's group. Yes, calling family members. Mostly we connect through text messaging. Somebody said, Janine said, we've played dice games over Messenger, Trivial Pursuit over FaceTime, and categories over Zoom. Excellent. Yeah, that's so good. My family and I we had 2 birthdays this week and then Easter. So we just all sat at our dinner tables and had Easter dinner together over Zoom. Let's see. My organization is offering training and assistance to our support group facilitators to move their groups online conferencing apps or to conference calls whenever possible. That is great. We've additionally expanded our online exercise, recreation, and enrichment program offerings. We realize that online solutions are not a panacea, but it is a move in the right direction while we are considering additional options. Absolutely. We can do what we can do right now with the information that we have. And I am really so impressed and so excited that we have so many things to share with the Parkinson's community, because this group, I don't know if it's everywhere. I'm not in every other community, but I'll tell you, when people got locked down, the Parkinson's community responded, and everybody's online and really trying to help. And I love it. Let's see. Book club meetings on Zoom. Yep. Helps with connections. Definitely. That's so good. 2 prayer groups online. Gosh, this is great. Let's see. Somebody said it's hard when a person with Parkinson's is losing the capacity to cook. It sounds like supporting the person to participate in these activities or having him observe and give tips while you cook. sadly, this is not possible when you're not able to visit care centers right now. Absolutely. It's really tough. It's really tough. But I love the idea of letting the person kind of share ideas, even if they're not able to with their hands or
Right.
mobility. Somebody said, what do you suggest when a person with Parkinson's is good at chess and bridge, and yet his capacity to be alert for the period of time required to play the game is not there? It says game flag. I think I'm misreading that. But what, in general, I would think get with people who are willing to place a hold on games. That happens all the time. Just put a pause on it.
Yeah.
And you can do that over Zoom right now. You can say, great, I'm going to play this. And you know what? I don't have it right now. Let's put the game down. I trust you. Put your cards there. We'll come back.
Yeah.
Here's the chessboard. We'll come back. I think that's a great thing to do. Let me just see if there's any other questions. He's doing it all those different stuff. Writing. My husband used to be a prolific writer. Since Parkinson's, he doesn't do it at all. I've been pushing him to journal just for him. He is doing it, although typing is slow. Yeah, that's tough. It connects him somehow to himself and lets him see that he still has such insightful things to say. I think that is super important, and what a great activity to do. I'm hoping he will share with trusted people eventually. That's really great. Let's see, connect via Zoom with families, Rocksteady and YouTube for many things, music, concerts, church, etc. It's amazing, right? We have everything up like. Learning curve for now isolated seniors, not computer nor smartphone savvy. Love how instructions set up, trying to help even older generation with hearing problems too and computer overload connect. Thanks for all you do. Yes, one thing I would recommend if you do have somebody who has hearing issues and this kind of thing is really difficult, whoever you're working with, ask them, hey, can you do a transcript of this? Like, there are so many amazing services right now. You can get a transcript in 30 minutes. It's not a perfect transcript, but it's really totally sufficient. So most people can do that. How do you play cards online? Well, you could play with a friend, right? You could just say, and we're gonna play, and here I'm throwing this down. But there are lots of online card games. So you could do that for sure.
Words with friends?
I can't recall now the site, but there's a Living History project where you can tape record interviews and with older people about their lives. So I think the one you're talking about, I'm not sure, is the legacyproject.org. It's amazing. I actually did a memoir with my dad through letters, using some of those questions and some of their materials, really interesting. So Andrew Lloyd Webber, free played on YouTube every weekend. That's amazing. Yeah, wow. So that's a lot. What else do we need to talk about, Al?
Yeah, well, just to add, adding a little bit to the list that you just reviewed, that folks, just these robust ideas, but now museums and art museums are doing virtual tours. Some of the great art museums in the world, you can actually do a virtual tour, and you can do it with other people, so you can be going through the art, gallery, and looking at the same image, and reacting with your fellow art aficionados as to what you see, or how the painting speaks to you. So these kinds of virtual things are really out there, and there's more and more being developed every day. I mean, that's one of the things about this pandemic and stay-at-home orders, is that it really is bringing out these brilliant ideas that people are coming up with, and ways and means to stay connected, to have a chance to express yourself, to really be with other people who share your passion, whatever that might be. So those are just some wonderful ideas. And just a quick postscript on that is I'm involved in a project right now as we speak with this organization called ANCOR. It's a trade association that it's the American Network on Community Options and Resources, is what ANCOR stands for, ANCOR. And I just did a video for them that we released that is getting people to do exactly what you just did, Mel, and that is to do some groupthink and to come up with some ideas, strategies, ways, and means. And so we put out a survey monkey through Anchor to all their members, and on April 27, which is a Monday, at 1 o'clock Eastern Standard Time, we're doing a free webinar where we're sharing these ideas that we gathered through this sort of virtual survey monkey conversation with people from really around the world. Anchor members are actually from around the world. And we're going to be summarizing these in a 1 hour webinar at 1 o'clock on the 27th of April Eastern Time. We're going to follow that up with a white paper that basically, writes down these ideas. And I'll make sure, Mel, that I get that paper to you.
That'd be great.
Because it'll be a public document. This is not proprietary. It's really designed to just give people ideas, of things that they can do to stay connected, to be connected, to build social capital, maintain social capital. So I'll get that to you, and maybe we can share that on the Davis Phinney website.
Yeah, absolutely. And we'll share the webinar too when we get this
up with that.
Yeah, we'll share that. The thing that I think is going to come out of this, one of the great silver linings, is that the amount of content that is being digitized and is now in library, when people go back and people are able to connect with their people and be able to go to their classes, there are going to be times when they can't. And now they don't have to miss anything. All of these things are going to be available to you. So it's going to be a time where we look back and be like, wow, we still have all of these things that we can do, even if I can't leave the house for whatever reason.
Right. That's right.
Somebody has asked about studies on social isolation and Parkinson's, and there are about social isolation and health. I will be sure to share those when I share the show notes for this. I will share those studies. I will share the Anchor talk that you just said, the webinar,
Yes.
and I'll also add that.
That'd be great.
That document.
One thing that's just to add to this is there's been obviously prior to this pandemic, there was a lot of interest in social isolation and loneliness, and there was a study that was conducted in 2018, published in 2019 by Cigna Insurance Company, Cigna, C-I-G-N-A, and if you Google Cigna loneliness study, just Google that in, the report comes up. And this was a study, Mel, that was conducted throughout the United States with 20,000 individuals, not people with disabilities, but just generic individuals around America in various regions of our state, various ages and experience levels. And they used the UCLA loneliness scale. Now, UCLA back in 1968, 69, created this loneliness scale that actually measures loneliness. And that's, by the way, also on the web. You can just Google UCLA loneliness study or UCLA loneliness scale, and it comes up. There's 20 items, and it creates a score. So when Cigna did this study using the UCLA loneliness scale, 20 items, 20 questions in a survey, they discovered that the loneliness benchmark had increased in the United States by almost 10 points. Now, the scale is 20 to 80, 80 being, really lonely, 20 being very connected. And the average in the United States was about 34. And then when Cigna did it, it's gone up to about 45 points. And so folks, if they're interested in digging a little deeper on social isolation and loneliness, they could take a look at this Cigna study, look at the results from the Cigna study, and also maybe Google the UCLA loneliness scale and have a chance to sort of look at it, maybe even take it. You can actually take the scale and get a sense of that to get a better understanding of loneliness and isolation.
Yeah. Well, this has been great. It's been I wish we had more hours to chat. For everybody on the webinar, we will have this recording available to you soon, and you'll be able to listen to it indefinitely as long as we're around. This video will be around. If you have any questions at all about this topic, please email them to me at dizon@dpf.org. And if I can't answer it, then I will reach out to Al and hopefully he can answer.
Absolutely.
And yeah, so thank you all so much for being here. Al, is there any final words that you'd like to share?
Yeah, just wanted to, folks to, again, if you're interested in more in social capital, take a look at my website, which is just my name, alcondeluci.com. And my TED Talk is on there. I did a TED Talk a couple years ago on social capital, and some other materials, some uploaded materials that you can take a look at to learn more about social capital, more from a sense of how do we build it. So,
Great.
Mel, this has really just been for me an incredible delight. I'm such a fan of the Davis Phinney Foundation and the work that you and your associates are doing in terms of living well with Parkinson's. I got to learn about the Davis Phinney Foundation through my experience with the Parkinson's Foundation in Western Pennsylvania, and my dear friend David Von Hoffen, who I think is on this webinar. And he introduced me to Davis. So I had, it's really kind of full circle for me. So I appreciate all the work you guys are doing.
Great. Thanks, everybody. And thanks, Al. See you guys soon.